Namaskar, dosto. Good evening, and once again, welcome to Fertility Dost. I would say welcome to New Year. Happy New Year to all of our viewers because this is the first session in this new year. And to make it more interesting, we are going to talk about ovarian cyst, ovarian cancer. So whenever we just start the treatment, we go for ultrasound scan, and doctor just checked the ovaries, and she said, "Oh, I could see a cyst in your ovary." And we, as a patient, like, "Oh, अब क्या होगा? Cyst दिख गया. मुझे तो follicles देखने थे. I want to have number of follicles, good number of follicles, and then good number of eggs. Now, what to do? Is there any harm? Is there any is there any bad things going inside my ovary, and automatically that cyst correlate to cancer? But actual में ऐसा कुछ नहीं है. Like we can say that it's a fear factor, or at times we just believe that googling things is really very good. So we just start googling things here and there, and again, we just fell into the trap of cyst, cancer, and now what happened? Okay, so not audible. Could any of the other viewers please just post in the comment box? Because before going live, I was quite audible to my team member. Please, anyone who is there on the live, please check it and let us know if I am audible or not. So, for this interesting topic, thank you, Dipti. Thank you so much for acknowledging. So for this, I can say that such in-depth topic, ART Fertility Clinic is our knowledge partner, and yes, we have very senior doctor with us, Dr. Alia from Hyderabad, to discuss about this interesting topic. So let me call her on the main screen, and we'll just start with the session. Namaskar, doctor.
Hello, namaskar, and once again, wish you all a very happy new year. And as Sankranti is coming, very happy Sankranti.
Right. And I think on that very note, the viewers, let's think about your treatment because हम बोलते हैं सब शुभ है तो treatment भी शुभ होगा. And I think each and every zone of India celebrates this. And
Yeah,
this is really very auspicious day to start your treatment or think about your journey. So viewers, we have very senior doctor with us, Dr. Alia from ART Fertility Clinics, Hyderabad. And I think as a senior doctor, she has treated many cases. I would say that इन्होंने बहुत चेहरों पे मुस्कान दिखाई है. So we hope कि आज जितने भी viewers हैं, they just get that feeling that yes, we are not alone in this journey. There are many good doctors, many good experts who can treat us wisely and nicely. So, viewers, we are just starting the session, and the topic is ovarian cancer doesn't have to limit your chance of becoming a mother. So, doctor, is it really so when we visit fertility clinic, doctor said कि cyst दिख रहा है. So, what exactly does cyst and ovarian cancer?
yeah. See, ovarian cancer is one of the deadliest, I agree, but it stands fifth in the world. The worst cancers, it follows breast cancer, common cervical cancer, thyroid cancer, Hodgkin's, and then comes ovarian cancer. And these cancers are not very appreciated in the initial stages. They usually happen in the fourth decade of a female's life. 40 के बाद हो जाता, कभी कभी 40 से 60 तक कभी भी हो सकता. Even premenopausal people also have, and it is difficult to diagnose this because it has a very vague symptoms. There are two different types of cancers ovarian. One is an epithelial cancer, one is non epithelial. Epithelial जो है वो जल्दी जल्दी बढ़ता, और non epithelial में उसमें germ cell या gonad या sex cord carcinoma, something all which is not that bad as the epithelial where you have a fast growth. और ये भी क्या होता मालूम, आजकल people are postponing their टू स्टार्ट अ फैमिली। पहले घर
Right.
होना, फिर कार होना, फिर बैंक बैलेंस होना, फिर जाके अपने को बच्चा होना। So because of that postponement, when the she might be single, she might be in relationship, she wants to start the family, she doesn't want to start the family, whatever is, when she's ready for it, and when she goes to a gynecologist, the gynecologist will suddenly say you have a tumor or you have a cyst which could be carcinogenic, and then it comes, "Arey, kya ho gaya? What has happened? This, that." So for such people, there is nothing to worry. The earlier you diagnose, the better. You have one ovary which is affected. You can always go for a radical surgery. Actually, cancer bole to we have to remove everything: uterus, both the ovaries, both the tubes, all these things. But it is not needed these days. When you are diagnosed with a cancer, find out the type of cancer, find out what age you are, and what is the advancement, कहाँ तक है, initial stages में है या ज़्यादा है, whatever it is, before you go for a cancer treatment for the removal, एक ovary अच्छा रहा तो भी you can save that ovary, and you can have uterus भी save कर सकते, ovary भी save कर सकते, you can go for the ovary which is bad, but before you go for the surgery. क्यों बोले तो, because when you start the treatment, because it is surgery followed by radiotherapy followed by chemotherapy, which decreases the fertility status of your ovary, उसमें से जो
Right.
एग्स रहते हैं वो कम हो जाते, so that shouldn't happen. So we have to first decide, let the gynecologist tell, and then it should be a core of doctors like a gynecologist, a fertility specialist, oncologist, and a proper psychological counselor. ये चारों बैठ के एंड पेशेंट के साथ अच्छा सा डिस्कस करो कि व्हाट इज इट, what do you want to do, how do you preserve her fertility. Oncologist bolega what is the stage, don't get fear, अरे कैंसर हो गया, अभी हो गया मेरा, this that, don't, you need not fear. In these days, I can tell you, you need not fear when you have a cancer of ovary. You can all, there are ways and means of saving it, your fertility status. So क्या
Right.
करना, you have a cancer, you go to oncologist के साथ बैठो, fertility specialist भी बैठेंगे, gynecologist भी बैठेगा, counselor भी बैठेगा, to decide what is the final thing, what should we do to preserve our fertility. So we preserve, then what is the impact, how many months should you wait for to go for a pregnancy, all these
Exactly.
things will be decided on the table, like before you go for any treatment related to carcinoma. So the first thing what we as an infertility specialist say, एक ovary निकल गया तो निकाल दो, then save the other ovary, remove the ovary, remove it in pieces, or if she's married, we can always save her embryos, husband के साथ embryos बना के IVF treatment करके we can freeze them up and then go for the treatment. If she's unmarried and she's single, you can always freeze her eggs. So these things, and she's young. Sometimes this carcinoma even attacks children of 15 to 19 years. So ऐसे लोगों में we can preserve the ovary by making into a small bits and preserve it. When the time comes, we can again replace it back, like transplant it back into a abdomen. So that can be done for younger people who have younger children, teens में ऐसा किसी को आ गया, तो that facility is there. But ovarian cancers are always middle age, 40 years के बाद ही होता है. So you can always freeze your, हाँ, it is a late onset carcinoma,
Late on. Right.
late onset, 60 65 लोग menopause, post menopausal भी कभी कभी हो जाता है. And if you have a hereditary, like you have a family history, एक 10 साल पहले आपको मालूम हो जाता कि you are suffering from cancer, और
Right.
जेनेटिक हिस्ट्री रहा, फैमिली में बहन है, माँ है, और कोई है कैंसर से, एंड दिस
Uh, I think there's some network issues. Okay, let us wait for the doctor. Can you see me and hear me clearly, viewers? I think मेरा network ठीक है. Okay, so we'll just wait for doctor to return back on the session on the screen. Viewers, there's Okay, thank you. Thank you. Uh, so, just one information I wanted to share with all of you. Our founder of Fertility Dost, Gitanjali Banerjee, उनका एक book आया है, A Practical Guide to IVF Treatment. I would suggest that each one of you, if you could order it from Amazon and read it, it's a really nice book. कुछ लोगों को पढ़ते हुए ऐसा लगता है कि हमारी ही शायद जर्नी उसमें लिखी हुई है. सो आई वुड सजेस्ट दैट जस्ट रीड, एंड इफ यू हैव एनी क्वेरीज यू जस्ट post it on the comment box, and we are just waiting for doctor to return. And viewers, we have our app launched on Android phone, so please आप लोग हमारे ऐप को फर्टिलिटी दोस्त को ज़रूर डाउनलोड कीजिए. आप उसमें इंफॉर्मेटिव चीज़ें देख सकते हैं. वी हैव मेनी इंफॉर्मेटिव मैसेजेस ऑन आवर ऐप. प्लीज़ डू डाउनलोड एंड हैव अ लुक ऑन दैट. आई डोंट नो डॉक्टर का क्या इशू हुआ है, सो लेट मी चेक. So any other query from your side, so please post it. So आज डॉक्टर आलिया से बात करते हुए आई जस्ट गॉट टू नो कि जो ओवेरियन कैंसर है इट इज नॉट वेरी कॉमन व्हेन वी फीमेल आर इन रिप्रोडक्टिव एज. सो इट मे बी ड्यूरिंग प्री मेनोपॉजल टाइम, दैट इज अराउंड 40 और सो. तब ये कहते हैं कि ज़रूर आप जल्दी से अपनी प्रेगनेंसी प्लान कर लीजिए, क्योंकि बहुत सारे प्रॉब्लम, बहुत सारे इश्यूज आ जाते हैं. एंड कभी कभी हम लोगों को लगता है कि बहुत सारे सिस्ट हैं ओवरीज में, या डॉक्टर ने बोला कि हम आपका ट्रीटमेंट नहीं शुरू कर सकते, सिस्ट हो गए हैं. तो हमें लगता है कि शायद वो एक कैंसर का ही फॉर्म है, बट इट्स नॉट लाइक दैट. सिस्ट जो है कभी कभी हमारे पीरियड फ्लो के साथ निकल भी जाते हैं. सो डोंट वरी अबाउट दैट. आई थिंक वी हैव डॉक्टर अगेन विद अस. Yes, doctor.
Yeah, suddenly it got disconnected.
Right, 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 right. No worries.
Yeah,
Absolutely fine. Thank you for rejoining, ma'am.
yeah, yeah.
So, doctor, we were discussing about ovarian cancer, and in between, it just crossed my mind that at times when doctor suggested that you have cyst in your ovary and
Yeah.
it will wash away with your period flow, what exactly does that mean? Because at times we usually correlate that cyst to cancer cyst. So,
No,
what
cyst
exactly?
usually happens. See, if your person is ovulating, sometimes it doesn't. The cyst ovulation का जो cyst रहता, जो follicle रहता, it will not be ruptured. So it is called retention cyst. Those are simple cysts. They have no harm. They are not called cancers. Endometriosis cyst is a different one, which is a chocolate cyst. Endometrioma बोलते हैं उसको भी. They are also not cancerous, but they occupy the whole of ovary, decreasing the number of eggs in that ovary. So that also is not cancerous. But the cyst which are like septate, जो जो ओवरी में अपने को cyst दिखते हैं, जो वो septate रहते, and they keep on increasing, multiplying. वो बारीक बारीक पर्दों के जैसा रहता है, it will be septate like that. Those are the ones which can be cancerous. एक
Okay.
dermoid रहता, mucinous cyst रहता,
Right.
pseudomucinous. Those are the ones which are very dangerous and lethal also. All cysts are not cancers.
No, okay. And doctor, what happens that I think it's a kind of myth. People always says that if I have taken n number of stimulations, or I am doing 3 or 4 IVF cycles, that means my ovaries are going to develop the cancerous thing. So
It's
stimulation.
absolutely wrong. It's absolutely wrong because whatever drugs we give, they have a half life which stays in the body for only that time, that period of time. It is get washed out. So it
Right.
number of stimulation will not be the cause. If you have a family history, if you have a hereditary genetic problem, only then those ovaries will develop into a carcinoma. Not just not because of ovulation. Because we have seen in India only hardly when they go for a second cycle only they start the cribbing. अरे 2 साइकिल हो गए, 3 साइकिल हो गए. But where I have seen in other countries outside India, where 20 cycles, 30 cycles also are done for them
Mhm.
because the government funds for them.
Ah,
They want
right.
to, the government funds it. Like especially when I have done my fellowship from Israel, Tel Aviv, there were 20 cycles, 25 cycles. One
Mm.
person was getting that because the government funds them. They want to increase the Israelis population, so their government funds them. So I have asked, when I was there, the same question I have asked the professor over there. Then he said the same thing. You are seeing for yourself, these people are, unless you have a family history genetically related, then it will not be there. Cancer नहीं होता.
Hmm.
That's it.
So, doctor, what are the precautions that as a patient or as a female I need to take if I have family history or genetic concern related to this cyst or, sorry, cancer?
Cancer. See, they are markers. Like you can know genetic history is one thing. Then you have
Hmm.
a markers. When you 30 years okay, so you start going for a regular routine checkups. CA 125 you can measure where you will know which has to be 35 to 37. If it is more, then you are likely to have a cancer. Genetic study you can do where where the gene will tell you whether you are likely to get a ovarian cancer in future. There are latest studies which can be done very early in your life. In टीनेज में स्टार्ट कर सकते हैं आप. आपका समझो योर मदर had ovarian cancer, your sister had ovarian cancer, or your grandmother had, so you can immediately know whether you are also going to have by doing a genetic testing the specific gene which is related to that, and then you can save your ovaries. फर्टिलिटी प्रिजर्व कर ले सकते हैं आप, परहेज कर ले सकते हैं. एंड
Right.
सेकेंड थिंग इज what about the treatment? There are MRIs are there. Even if you have detected it later, you can do an MRI, you can do a CA 125, which will tell you exactly where you stand, whether this is a carcinoma or whether it is a simple cyst or कुछ भी रहने दो. So you these days you need not fear. We all are there. We all the doctors and the counselor will work on the patient. The patient should not panic.
Right.
We should tell her. See, if sometimes it so happens, like pregnancy aa gaya, she goes for a regular checkup, and then the doctor says, "Arey, isko ovarian cancer hai." Then also she need not. We can wait. Like we to start a treatment, we have to wait for at least 14 weeks till the fetus is safe. The fetus, it will not go for miscarriage, it will not go for any, it will not harm the whatever treatment the oncologist will give will not harm the child. That is, we have to have a period of 14 weeks at least, and then you can remove the tumor whatever it is, and then the pregnancy can go on. And early delivery, 36, 37 weeks may you can go for a delivery. There are cases where they have given good children live birth of those children are not at all harmed by the treatment what the oncologist has given. So only thing is the time period. So if you have been detected with carcinoma and you have underwent all the surgery, fertility preservation हो गया आपका, and you want to start a family, but you have to wait for a period like 3 years, 4 years, or depending on the severity of the thing, there is a period limit where you should wait before you start a family. So that also we give you, we counsel you, we'll tell you that you can. It so happens किसी को कैंसर बोल दिया तो बोलते हैं अभी कैंसर, अभी जीने का क्या फायदा. It's not like that. You have all the reasons to live, you have all the reasons to have children, a healthy children, normal children. We have ways and means. The science has been so advanced. You need not worry at all. Only thing they should understand, we should counsel them properly. We should counsel them to preserve their fertility because that is a difficult part of it.
Right.
And you should tell them what is the cost which goes in for it. If it is an IVF, what is the cost? If it is this, what is the cost? Fertility, I mean ovary preservation. So these are all should be spoken with the in the presence of an oncologist and a counselor and the fertility specialist, so that they understand. The treatment, oncology cancer treatment itself is very costly. Chemotherapy,
Very.
radiotherapy, pura. And including this also, it's a problem for them. So they should understand. If you have, if not, you don't want to go for it. You want to wait till you are to see that you are alive or not. Uh, अगर मैं जिंदा रहूं तो. So there
Right.
are again means of getting it. You can always go for a donor eggs. Your uterus is removed. You can always go for a surrogacy. So if she is married, the husband also has to sit and listen to all the options she has.
Right.
And they say latest what they are saying is that if you remove the tubes,
Hmm.
salpingo bilateral salpingectomy is the main source of cancer for an ovaries. That's what is the latest study. So they say, suppose if you remove those bilateral tubes, so
True.
yeah, it decreases because it is. They say it is linked up to the ovarian cancer. So only thing is, whoever has this, you can't avoid it. Only thing is, you face it, fight for it, and get it done.
Right.
Preserve.
And I think the right, getting right information and meeting the
Yeah,
right doctor is
right
really important.
doctor. That is important. See, oncologists, what the fertility letters, they'll be in a hurry to do that.
Right.
And
Right.
we fertility specialists also, we don't want to waste their time because they
Hmm.
say in another 2 weeks you have to start. 15 days में आ जाओ chemotherapy वो ये वो बोल देते. So we also don't want to waste their time because we know time is very precious. So
Right.
we in fertility we also do a random start. जिस दिन भी आने दो, irrespective of a period, we start the stimulation. We start
Okay.
the stimulation, huh? We start the stimulation. In that limited period only, we gather eggs, we form embryos. 10 days, the other person. Randomly start. That is called randomly start. And sometimes to get more, we do a dual stimulation also. Because we'll not be getting them back again. So,
Hmm.
अगर समझो थोड़े थोड़े बहुत सारे एग्स 10 mm में है और एक 8-9 अच्छा बढ़ गए तो we remove that first and then again we'll give stimulation for 4 days. Dual stimulation बोलते हैं
Okay.
इसको. Again
Okay.
pick up the rest of the eggs so that we want more eggs to preserve her fertility. So
Right.
we are ready with everything. The right, as you said, the right doctor, the right hospital, the right clinic. We can do anything for you people. We can do
Right.
miracles.
Right. I think that's really important because cancer itself is a very cancerous word. So whenever we hear that word, is that okay? Now, सब कुछ खत्म है.
हाँ,
Hold on
कैंसर
with
समझ लेते हैं उन लोग.
right,
No,
right,
that's it. Don't panic. That is the main thing. Sit with the right
mm,
doctor. Sit with the right person. Get your husband also understand what is it. Your parents, your husband. सब कुछ सबको मालूम रहना चाहिए कि what is black and white. This is this. This is this. What is the outcome? What is the future? What is this? So it will be easier for a girl to live her life
mm,
full.
right, right. So, doctor, nowadays there's one very common thing when we are talking with our members. So, few of them are talking about NK cells, or few of them are talking about killer cells. So, what exactly are these killer cells? Is there any correlation with these killer cells, NK cells, or cancerous cells?
See, we need NK cells. There are two types of cells: uterine NK cells and blood में NK cells रहते हैं. So
Oh,
what are important is uterine NK cells because they help in implantation. They help in invasion of the fetus, the embryo, into the endometrial cavity and start developing. So uterine NK cells should be normal, and we need them. They are the good cells. They are not the killer cells. They are
oh,
natural killer cells, but they are uterine, they are good and they help us in implantation. So I have seen many people coming with that reports of NK cells, IE, इसीलिए implantation नहीं हुआ, that, this. So, see, they are good cells, but the only thing is you have to put them empirically, NK cells head, aroma, give them a proper counseling and tell them that these also are required for you to become pregnant. They help you in becoming pregnant and any immunological treatment required empirically they don't know so that they conceive they get implanted the IVF is a success and they continue the pregnancy and deliver a child so that fear I have seen in many people अरे NK cells है बोले मेरे को नहीं आया इसीलिए नहीं आया there is nothing like that जो उन लोग देखते हैं वो blood के NK cells रहते हैं All
Okay.
the people who undergo these investigations are related to blood only. Nobody
Right.
bothers to do the uterine cases, which are very important, and which are the good ones.
Good ones. Right.
Good
Right.
ones. Yeah.
So, doctor, when you just suggested about this uterine NK cells, so is there any different test to know about these NK cells, uterine NK cells, or simple blood test
Simple blood test only. Only you can't see them. You have to do only in blood. You can know the cells. So
cells?
that's the reason we put them on empirically on immunological
Immune.
uh, treatment.
Right, right. And for how long should one be taking such kind of treatments to before starting the
See,
fertility?
इमोलॉजिकल फैक्टर्स है जो एसएलईज रहते हैं, एसएलई
हाँ
सिस्टेमिक
जी,
ग्लूकोज, हाँ वो एक, और थोड़े एक दो जॉन सिंड्रोम कुछ है, ऐसे दो तीन है वे यू हैव टू पुट देम ऑन ट्रीटमेंट. Sooner, when you are starting an IVF treatment, before you go for an FET, you have to treat them empirically. Before only, it's steroids with immunoglobulins and all these things, and you continue for some time because their body doesn't accept it. So they are, depending on what they are suffering with, you keep the treatment for this much period. And सबको एक ही जैसा नहीं रहता treatment. It
नहीं
depends
रहता.
on individual to individual.
Right. And again, the time period of
Time period also depends on.
differ. Doctor, we have one interesting query. So some lady is asking about heparin treatment. So
Yeah.
is this really common treatment? Because she is asking that two of the doctors which she visited in the past, they mentioned about heparin treatment, and the recent one said no need to go for this heparin treatment. So what exactly is this?
Heparin is, yeah, heparin is nothing but a blood thinner.
Right,
Blood thinner. See, if you are aged, you're above 40, and you have the problem, you had one IVF failed, you had abortions, and all these things. So, when your blood is viscous, it helps in thinning that blood so that they are fine capillary sort of vessels which reach the fetus, which helps in implantation. The spiral arteries, they are hardly to be seen. So, when the blood is thin, it gives proper nutrition and blood to the fetus. So when you are aged, when you have a repeated thing, and you are again detected with some blood investigations for thrombophilia panel like APTT, prothrombin time,
good,
active prothrombin, APTT, PT, and all these things. If they are high, they are raised. That means your blood is viscous, or you
okay,
have more RBC in your blood, where the blood is thicker. So such places only you put them on heparin treatment after transfer.
after okay. So she is asking that what exactly I should do.
I mean, it depends on her age and what factors. Like as I told you, there's a thrombophilia panel investigations which she has
Right,
to undergo, and if there is anything abnormal in that, only she'll be advised to take heparin. Just like that,
right.
nobody gives them heparin.
Right. And see, if you are in Hyderabad, you can visit the doctor and just visit with all your reports and everything so that she can guide you properly. And I would suggest that rather having doubts in your mind, please be open, please do consult each and everything with your doctor because she really has to know your mental state, where the treatment, how the treatment you are taking in, and where the treatment actually stands. So I think if you have any doubt, please do visit the doctor. And doctor, one last question about this ovarian cancer. So many times when doctors suggest you that yes, there's something related to this cancerous thing, we don't have time. At that time, we just think about के जान बच जाए, fertility तो मैं बाद में देख लूंगी. So what exactly, like what you want to suggest in some case, in such
Yeah,
cases?
that usually happens. But what I suggest is that's the reason I said proper counseling with the
Right,
oncologist, with the fertility specialist, with the gynecologist, and a psychologist. She should be under the umbrella of all these four people so that we'll be able to convince her from all the angles. Like तुम्हारा अगर oncology treatment हुआ तो what is the future, how long are you going to live. तुम्हारा अगर fertility preservation हो गया तो when you can start your family. And then the gynecologist what she wants to do, whether depending on your stage, whether she would like to remove only the ovary or remove both the bilateral oophorectomy, both the ovaries, your uterus, and related what do you call that, lymph nodes also, so that
Okay.
it doesn't again recur. So the gynecologist will think in her way that pura nikal denge pura. So depending, if we preserve this, she can go ahead with it. If you preserve her fertility, she can go ahead and we can always go for a surrogate with our own babies.
Oh, no.
Surrogate
Right.
can carry our child. So there are ways and means, nothing like you have to panic. Proper counseling, proper understanding of your. I say, Sunti, see anybody in,
Right.
even if we suddenly somebody tells us this, we get panicked. So don't panic. Try to face the things. Try to understand your problem. Try to know what can be done for it, and how best you can live, and how best you can have your child. Those are all very important for us. And one more thing I want to tell you is there is a newest treatment approved by the FDA, which says that antibodies that deliver a targeted dose of chemotherapy directly to the cancer cells, which is
Oh,
newest, which is still uh, in
oh,
trials, where you can use that. It is called Elhira. Elhira.
I-
Elhira, it's called cancer. So it targets the cancer cells. So those we might come out in future. So that will prevent most of the initial stages also. We can put that chemotherapy. And second thing, which is most important, what I wanted to tell all is people who have suffering from breast cancer, who have this genetic of BRCA1 and BRCA2, you always be under the scan. You get an MRIs and CA125 frequently being done, because this cancer is related to the ovarian cancer because they carry the same cells. So when you are going for a mammography, because certain places it is mandatory that they do every year mammographies. In some corporate hospitals, corporate
right.
IT things, they it's mandatory that they undergo pap smear bolte hain, and mammography bolte hain. If you come across BRCA1 and BRCA2 gene in your mammography, you always check for this ovarian cancer also by doing a MRI and CA125. So you'll know whether your ovaries are healthy or they are affected. And people, and this is most common in people with breast cancers के उन लोगों को भी ovarian cancer होने के chances ज्यादा है. And
Right.
second thing is colorectal cancer. People also, the same
Hmm.
cells goes in for this. So people who are suffering from intestinal cancers, colorectal, rectum cancers, yeah, colon cancers, should also be very vigilant and try getting your scans regularly, MRIs, your CA125, so that you know exactly if there is anything. It is treatable. पूरा निकाल के फेंक दो, हो जाता खत्म. You need not, and few months of chemotherapy and radiotherapy would put you back onto your toes. So there's nothing to worry. So these people especially should make it a point to understand and be careful and vigilant and get repeatedly tested for those things.
Right.
Because
I
unless
think
until the cancer is see as I told you in the beginning, it doesn't have any symptoms. It's a
right.
vague symptom. The symptoms कब आते when it is more like,
Hmm.
and those symptoms also not related to the cancer, like bloating, gas बन गया, या
Right.
भूख नहीं लग रही because of the gas, या you're losing weight, just like that. So
Hmm.
these
Right.
are the few symptoms you find which can be related to the ovarian cancer. So heaviness in the abdomen, bloating feeling, not feeling like eating, and losing weight. These are the few symptoms which you can. If not, nothing is seen. Nothing is known unless a doctor tells you you are having a cancer. So even if you find these few symptoms also, you better get checked by a doctor, a gynecologist, या जो भी है. एक बार
Right.
दिखा लो, don't take it for granted. Gas boil के नको, don't
Hmm.
neglect it. Don't say, oh, it's only a gas, I had biryani yesterday, because of that I had gas. Don't neglect certain things. You be alert, try to understand your body, try to get it checked, because there's no harm in getting checked. Prevention is always better than a cure.
Right, right. And it is really very important factors or very important pointers that you just mentioned between the correlation between two types of cancers. So I think that's the reason we really want the senior doctors, good doctors on our platform. Seriously, ma'am, it's बहुत छोटा चीज है बिकॉज दो टू कैंसर्स आर इंटर बट कभी हमने पढ़ा नहीं कभी हमने सुना नहीं इट्स न्यू थिंग एंड that is what we call awareness. So viewers, please do take a note, and if you have any family history related to this cancerous thing, then don't get scared, just visit the doctor, get each and everything checked at right time. And if you have any friend or any person related to you who is dealing with such issues, then please do help them, connect them with the right doctor. And Hyderabad people, if you have any concerns, please do visit Dr. Alia Reddy to get you fully checked. And fertility journey की तो बात ही क्या है, she is master of all. So thank you,
One
ma'am.
more thing I want to tell you is, even postmenopausal females who are above 60,
Hmm,
60
hmm.
or 70, the highest, the last age which we have found ovarian cancer is 72.
Oh,
So even in 72, you have found ovarian cancers. So postmenopausal women also don't think, अरे menopause आ गया अब क्या बिगाड़ेगा मेरे को. Don't think that.
right,
Don't be under that impression. If you have these signs like bloating, not feeling like eating food, you're feeling heavy, you're losing weight, it's not because of the age, because of anything. Just get it checked repeatedly, yearly checkups. कुछ तो भी करा लो, master health checkups करा लो, so that you know exactly where you stand. So menopause हो गया, बच्चे हो गए, शादियां हो गए, सब कुछ हो गया, I have nothing to do. Don't be under that impression. Even 60, 60 plus, 70, there are chances that they also can be affected with ovarian cancers. So
right.
they can, in time, they can think, get it removed, everything. They
So
need not have a
everything.
fertility preservation.
Right, right, right. That is the easiest way we can do. And every time hormones को blame करना नहीं चाहिए. We really need to get checked timely.
Awareness रहना चाहिए.
Awareness is really important. And viewers, I really suggest that please do watch this session again. There are very important pointers which we discussed with ma'am during the session. Please do check and share the link with your friends and families. Thank you, doctor. Thank you so much
Thank
for
you
joining
so
us.
much for having a patience listening. I'm very happy to bring awareness to all of you. Thank you so much.
Thank you. Pleasures. Thank you.